Thanks for joining us again today. First of all, I'm Senator Jeff Schmidt from the 31st Senate District. I work out of Eau Claire County, but I am in my office in Madison, and we're going to talk to a couple of very important people with a lot of information for us about the challenges we have with early child care these days. So let's have them introduce themselves, and we'll start with Ruth.
Good afternoon, everybody. I'm Ruth Schmidt. I am the Executive Director at Wisconsin Early Childhood Association. We are a membership association and do significant public policy and advocacy work to promote investments in early care and education. And then we also do a lot of direct service provision to people who work in early care and education and to child care programs across our state.
Thanks, Ruth. And Marianne.
Hi, thank you. I'm Marianne Torkelson, and I'm from Black River Falls. I'm the Vice President of Business Development and Training with Co-op Credit Union. And I'm also the chairperson for our Jackson County Child Care Network, which is a group of businesses and community members that are working to address the child care issues that we have in Jackson County.
Marianne, would you start us off and tell us more about that? I've been intrigued, and I've been really enthused that that this has become something that the business community has rallied around. You want to talk about that?
Certainly. It all started with a conversation in the lobby of the credit union one day. Kevin, the CEO of Jackson Electric Cooperative, was talking with our CEO and talking about different work issues, and the topic of the struggles with employees finding childcare came up. And both organizations were seeing people that couldn't work to their full potential, young moms or young dads were maybe staying home after the birth of a child because it was difficult to find adequate childcare, and it was becoming a real workforce issue for us. And so from that conversation, we've blossomed into a group of business leaders. We have representation from several businesses in Jackson County. The Black River Memorial Hospital is represented. Millis Transfer has been represented. Manufacturers, both Regal and DNS Manufacturing, and the school district of Black River Falls was active, of course, early on. And we've also grown to invite people from our Department of Health and Human Services. We have people from child care providers. And what we have done is really started looking at this issue. We asked Chris Hardy from the Seven Rivers Alliance to join our group, and he brought the aspect, they've been working on this in the Seven Rivers region as well. And he introduced us to a study that he had done with the Parenting Place, or that the Alliance had done with the Parenting Place, studying childcare issues in Juneau, Monroe, and Jackson counties. So with all of that, we've kind of moved forward and looked at the issue and come up with some ideas to hopefully make childcare more accessible and affordable and maintain a high quality of childcare in our community.
And Ruth, how about filling us in a little bit more about how the Early Child Care Association works and the broader view that you bring to the table?
Yeah, so I will probably go more towards talking about what's going on in childcare right now in our state and sort of what the core issues are that are facing us in terms of challenges. So my association, we have about close to 50 staff that work across the state in providing services such as stipends to people that work in the childcare field, scholarships for individuals that want to take credit-based education. We do a nutrition and food program. We do shared services, which is a new way of looking at creating sustainability within the business structure of childcare itself. And at some point, Marianne may say a little bit more about that because we're doing that with her group in Jackson County. But I think that what's crucial for us to understand is that going into the pandemic, like prior to the pandemic, we already were facing some significant concerns in childcare in our state. As you had indicated earlier, Senator, a huge portion of our population lives in a childcare desert, which is defined as more than 3 children in childcare age for every regulated slot of care in a community. And so in rural Wisconsin, that was pushing 80% of the population living in a childcare desert. So I think to us, what becomes critical in this is that the economy of our state cannot function without working parents, and working parents cannot work without access to high quality, affordable childcare for their children. And so that's a critical issue for our state when there simply is not enough childcare available. And when there is childcare available, it's very costly for parents to purchase. It often exceeds what a family is paying for their mortgage or for healthcare. And so we have this really fragile system that has been sort of overtaxed and is sort of starting to impact the way that parents can work and that our businesses can hire and retain young talent in their communities.
A childcare desert really does cripple families in community and business. So Marianne, do you want to talk more about how that does impact our community and employers as well as parents?
Certainly. We did two things. First, we surveyed parents, foster parents, those who are caring for children in the home, and we really wanted to get a pulse on those caregivers as to what kind of struggles were they seeing with childcare. And many had to miss days from work because of childcare issues. Many were late for work because trying to scramble and find adequate childcare for the day. Many people, while they're at work, are trying to make childcare arrangements and juggle. And so we asked the Seven Rivers Alliance to take some of those results that we had and put some dollars to the number of hours and the lost productivity that employers in Jackson County were facing. And it was over $2.5 million a year in lost productivity that employers were facing. As we surveyed our employer group then, the results were very, very similar. And for both groups, access to high quality, affordable care was very important. And the employers also talked about the huge need for shift coverage for childcare. Many childcare providers in Jackson County aren't able to reach into, second and third shift care. And so that really becomes a struggle. And we found that parents were just doing whatever they had to do to be able to find a place for their child and be able to work. A lot of overtime is missed, that kind of thing. So, and even more so, the kids, we heard stories of kids going to bed at night, mommy, where do I go tomorrow? And mommy was tucking their little tyke in bed and said, you know what, I don't know yet, but we'll figure something out. And so that lack of consistency for children in that 0 to 5 is so important in the growth and development of children. So
so this is not a problem that is going away with the pandemic, because this was well before the pandemic that this had become a problem. So Ruth, though, could you tell us how the pandemic has affected this problem, or exacerbated it, or illustrated it maybe?
Yeah, so I'll come at that from a few different perspectives. One, I think, is to point out that the early care and education industry in Wisconsin, childcare, was urged to remain open throughout the pandemic so that essential workers could go to work. So healthcare providers, doctors, nurses, paramedics, EMTs could all go to work and know that their children were still in safe care. And the challenge with that was that while we needed care to be available for essential worker families, we also know that a lot of families pulled their children out of care because they were now working from home, and they didn't necessarily want their kids in a group type of setting for childcare, right? We also know we had a lot of our school districts across the state where the school buildings closed and they went into virtual learning situations. And so we also had a lot of school age kids that also needed care if their parents were working in essential worker fields. And so those kids were coming into care. So there was this considerable shifting happening in terms of who was in care, how much care was provided. But the bottom line was that the majority of childcare programs were operating on greatly reduced enrollment. And on average, we saw that programs were at less than 50% enrollment. Mm-hmm. So they were encouraged to stay open, but there wasn't enough revenue coming in to meet sort of these super narrow margins that childcare operates off of. It's not a business model that works terribly effectively because of the cost of care for families and what families can afford to pay. And so we saw a lot of programs that attempted to remain open, attempted to keep their staff employed, but their earnings plummeted. And without federal funds coming to the state and without the governor putting additional money into it, we suspect we could have lost over half of our childcare capacity in the state. As it is, we've lost about 15%. So that amounts to about 25,000 slots of care. So if you think about communities that were already operating in a childcare desert, and then we take away 25,000 slots of care, so 15% of our regulated capacity, you can just imagine as we emerge from COVID, the challenges that this is going to create for parents that need to find safe, high quality care for their kiddos so that they can return to in-person working. So we saw lots of programs temporarily closing classrooms, laying off staff. But I think it's also important to mention, Senator, that the state did get considerable CARES Act funds that they were able to turn around and push out the door to childcare to help them keep their doors open. But right now, those childcare programs have not received any additional federal supports since November. So we're at this kind of sort of fragile place right now where we really need additional federal stimulus dollars coming into this field so that the state can get this money back out to childcare programs to help them keep their doors open.
And I remember that being discussed just before the American Recovery Act was voted on in Congress. How scary that was, thinking I'd heard numbers even higher than 50% were going to close across the nation if something didn't happen. So hopefully that things get moving fast so that they do not have to close their doors. Because Marianne, that would be a disaster, wouldn't it, for the business community and our recovery of our economy, right?
It certainly would. And one of the things that we did was we looked at the group centers. You have group centers and you have family providers. And we looked at the group centers and said, can you tell us, you don't have to tell us who the families are, but what employers are they coming from? And it's really a mix. There's not a big saturation of one large employer utilizing our group centers. And so this mix of the business community that's touching these childcare providers is huge.
I really appreciate this information today. This is really important, and I hope people are listening. And this is sometimes flies under the radar how important this is to our communities. And appreciate what you two both do. So, Ruth, do you have a final word for us of what we do going forward?
Yeah, I mean, my final word would be asking people to participate in our political system. So we've got a state budget that's up for consideration right now. The governor introduced it. It includes $106 million in new state general purpose revenue to go towards childcare. We need to hold on to it. We need our Joint Finance Committee to hear from folks across the state, to attend those listening sessions that they have on the budget. And tell our legislators that we need to hold on to this state general purpose revenue investment in childcare. It's going to be absolutely critical for our economy that we hold on to that investment. So that would be my takeaway, is participate in our political process.
That's great, Ruth. Thank you. And Marianne, what's your last word?
I think mine would be do what you can at your local level. I think the reason that our group has been successful is because it's what's working for our community. Our business community came together. We certainly couldn't be doing what we're doing without the help of the relationships we built with WICA, others, partnerships and providers. but don't just wait for somebody to come and fix it. You know, as we all want our communities to grow, we all want to see people flourish. Get a group together and start talking about it. And I think you'd be surprised at what a few people can do and move forward with that.
We need it all, right? We need the local support. We need the general state support and federal support all the way across. It reminds me of this is like an extension of buy local, eat local, all of those things, right? So supporting
Right.
neighbors. So thank you both for being with me today. This is really helpful. Thanks.
Thank you.
Senator.